If you have rib pain, it can literally take your breath away. And there are many different things that can cause rib pain on one side of the body. You may feel it in your chest. You may feel it on the side of your ribs. You may feel it on the back of your ribs between your shoulder blade and spine. Or you may feel it just underneath the rib cage. And each of those has a different cause and therefore different solutions. So in this video, I'm going to show you solutions for each of those various types of rib cage pain. But before we jump into that, we first need to discuss who this video is not for, because there are also some serious things that can cause rib cage pain that these type of treatments or exercises are not going to help. For example, if you're having left-sided rib cage pain right over your chest, make sure to rule out that you're not having a heart attack. If you've fallen and landed on your ribs and think you may have a broken rib, please rule out that you've not broken a rib before trying these tips. These may be helpful several months down the road after the rib heals, but if you have an acute broken rib, unfortunately it just takes some time for that to heal up. Additionally, some of your digestive organs, your liver, your gallbladder, your stomach, those can all kind of refer pain into the rib cage area as well. So if you notice that your pain is triggered with certain types of food or after you eat, then make sure to rule those things out as a cause of your rib cage pain. But if your rib cage pain is more musculoskeletal, it only really hurts when you do certain types of movements or maybe when you breathe in deeply or cough, then this video is for you. So the first type of rib cage pain that we're going to discuss is the type right between the shoulder blade and the spine. That's probably the most common type of rib pain that people experience. And most people, if you press in that area, are going to be a little bit sore. Often there will be an area that sticks out, like one of the ribs is sticking backwards more than the other. And it's probably abnormal to be completely normal in that area, but when it becomes a real problem, you want to take care of it. So here's the first tip to help if you have a sore rib on one side of your body between the shoulder blade and spine. Often one of the treatments we'll use in our physical therapy clinic is manipulating the thoracic spine or rib cage. Provided that there's not osteopenia, osteoporosis, or a fracture, that's generally a very quick and easy way to relieve pain, at least in the short term. But at home, you can do that using a foam roller. If you lie on the floor with the foam roller underneath your back, and then give yourself a big hug like this. This will get your shoulder blades out of the way so that you can hit the thoracic spine and rib cage a little bit better. And then just roll back and forth. And it's very likely you may hear or feel some snaps or pops. If you're just rolling kind of in a neutral position like this will probably target the thoracic spine more than the rib cage itself, but that often helps relieve pain. Additionally, you can move more towards one side than the other, and that'll target the joint where the ribs join with the spine a little bit better. So you can move from one side to the other side, but if it's one side you're having the pain on, you want the side that you're having the pain on to be down towards the foam roller. Now, although foam rolling can help relieve the pain rather quickly, it usually doesn't last over the long term. And the reason for that is there's usually muscle imbalances that have pulled that rib out of place, so to speak, in the first place. And if you don't correct those muscle imbalances, it's likely that the discomfort will come back eventually. A lot of times that has to do with one shoulder hanging down lower than the other one, which can pull some tension on your neck muscles and the nerves in your neck that actually can refer pain down into your shoulder blade and rib cage area. Furthermore, your rhomboids, which connect your shoulder blade to your spine, are put on tension when one shoulder blade is hanging down lower than the other one. So if it's your right shoulder blade that's hanging down a little bit lower than the other one, then you'll put your right arm up in the air like this, reach up as high as you can comfortably, and then take a deep breath in to the right rib cage. This fills your rib cage, or your lungs rather, with air and helps expand the space between the ribs. It also elevates your shoulder blade and takes some tension off of the nerves in your neck as well as the rhomboids. Reach up and hold that position. And then breathe out. Reach up again. As you breathe in, hold that up position with your arm. And breathe out. And repeat that for about 5 to 10 breaths where you reach up on the inhale and then hold that upward reach position as you exhale. That also activates your serratus anterior, a muscle that attaches from your rib cage to your shoulder blade and helps raise the arms up. So that can also be good for a different type of rib cage pain. For example, if you have it in the front. Front rib cage pain, or costochondritis as it's sometimes referred to, is when the joint between the sternum and the rib moves forwards a little bit. There's costal cartilages that attach the rib to the sternum, and a muscle imbalance between the chest muscles or other muscles in the front can pull one of the ribs forward, putting stress on that costal cartilage. Now, long-term relief comes down to fixing the muscle imbalances that cause the rib dysfunction to begin with. So often that has to do with proper sitting and standing posture, as well as exercises like the one I just showed. But what do you do in the short term if you've got an acute rib dysfunction or costochondritis and you feel a really sore, tender area in the front part of your chest? Well, here's a short-term pain solution to help with costochondral pain. A quick tip to relieve front rib cage pain or costochondral pain is to take a fist and put it over top of the sore area of the rib cage. So if the sore area is right here, you may notice that one rib kind of sticks out more than the other ones. And take your fist and put it over top of that sore rib area. Then you'll take your opposite palm and place it over top of your fist. Now you need to stand facing the corner of a wall or the inside part of a doorway and press your elbow into the wall or the doorway. You're going to press the elbow into the doorway while pushing back on the rib. So this causes a little bit of a trunk rotation when you're pushing into the wall or the doorway with your elbow, while simultaneously you're pushing the rib backwards. So press into the wall, press on the rib, and hold for about 5 seconds. And then relax. And repeat that process about 3 to 5 times, pressing into the wall with your elbow while pressing into the rib with your fist. Then do it one more time. Press into the wall with your elbow, press into your rib with your fist. And that often will relieve front rib cage pain rather quickly. Now again, that doesn't fix the underlying postural problems or muscle imbalances that cause the issue in the first place. But if you are having more of an acute chest pain that's not caused from a heart problem, this is something that can often help relieve the pain rather quickly. Now, what about rib cage pain on the side of the rib cage or underneath the rib cage? Again, you want to make sure that you've ruled out that you don't have a rib fracture and that it's not coming from an internal organ. But if you've ruled those things out, just doing some stretches to the abdominal muscles and to the muscles in the intercostals can be helpful. That stretch I showed earlier where you have one arm overhead and you're breathing in can be helpful. But another really helpful thing to do is just learning to breathe using your diaphragm. Your diaphragm is a dome-shaped muscle, and it acts kind of like a plunger. That dome flattens out to increase your lung volume, which brings air into your lungs. And then when the dome goes back up, it forces air out of your lungs. Now, when that dome drops down, your belly actually moves out. And many people do that backwards. They breathe the opposite way that they should. So when they breathe in, they kind of bring their belly in like that and breathe out. They push their belly back out. But the way that your diaphragm is designed to work is that when you breathe in, the dome drops down, your belly moves out, and air rushes into your lungs. Then you push your belly back in, or rather just let your belly fall. That brings the diaphragm back up, and air gets pushed back out of your lungs. So practicing taking a deep breath in, pushing your belly out, really expanding your rib cage and belly as much as you can, and then just letting your belly fall and the air goes back out. If you breathe using your diaphragm properly, it shouldn't really sound like deep breath sounds like it should just be more of a quiet breathing where you're doing belly out, expanding the rib cage, and then letting the belly fall and the air comes back out. Belly out, expand the rib cage, and belly in, and air goes back out. So those were some self-help tips to help if you have rib pain on one side of your body. Now, if those don't help, again, make sure to rule out more serious causes. And additionally, seeing a physical therapist for more specific joint and soft tissue work, as well as addressing the underlying postural problems that cause the rib pain in the first place, can definitely be helpful. And if you are in the St. Louis area, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, check out this playlist with posture tips right over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.